know that particles from smoking, fossil fuels, natural gas, wildfires, dust, mold, radon, and pollen decrease air quality? But why should physical therapists care about air? According to the World Health Organization, 1/3 of stroke, lung cancer, and heart disease incidences can be attributed to air pollution. Without regulation, poor air quality will continue to affect patient populations and increase the prevalence of chronic health conditions, resulting in increased healthcare expenditure, increased rates of disability and mortality, as well as decreased quality of life for patients. Although it may appear that Wisconsin has clean air, there are numerous harmful pollutants present that are invisible to the human eye. In fact, there are many areas throughout the state which have ozone levels above federal health limits. Ozone is a harmful pollutant that reacts with biological tissues in the upper respiratory tract, which can elicit local and systemic adverse responses. As physical therapists, it is also important to consider the negative effects of air pollution on health and exercise performance with physical activity. When a person is physically active, their respiratory rate increases to adequately supply oxygen to the working tissues. If a person is exercising in a polluted environment, these toxins are brought into the body with every breath and can lead to significant negative health outcomes. It's especially important to consider pediatric patients or patients with asthma or cardiovascular concerns, as they are more vulnerable to inflammation from air pollutants. What can you do for your patients? Make sure that air in your clinic is safe to breathe with the use of air purifiers. Encourage inhaler compliance and make sure your patients understand their medications. Inquire about patients' air quality at home. Did you know that poor air quality is linked with neurological impairments such as dementia? If you notice sudden changes in your patient's cognitive status, make sure you inquire about air quality. Educate patients to turn off the gas stove when not in use. Educate patients to check pollution levels before exercising or spending time outside. Collaborate to come up with alternatives for transportation, recreational activities, and exercise when air quality is poor. Research shows that climate change will worsen air quality through increasing ground level ozone and allergens like pollen. Big decisions regarding climate change are in the hands of elected officials. It is up to our state to elect individuals who care about the climate crisis and pass legislation to protect our state and our planet. You and the patients you treat have an important voice. Use this QR code to order a free voter registration badge with a QR code that enables patients to register to vote, request a mail-in ballot, or learn about upcoming elections. Want to help prevent these health issues in the first place? If you care about the air, sign up for the Healthy Climate Wisconsin newsletter for ways to be an active part of improving air quality around you and around the nation. Together, our small contributions can help make the earth a little greener.